Hi, my name is Seongeun. I'm second year doctoral student in counselor education and supervision program at Michigan State University. I'm honored to sharing my research titled How Emotion Dysregulation Shapes the Alcohol Abuse in People with PTSD Symptoms, Mediating Effect of Experiential Avoidance. I've worked with Dr. Kim and Dr. Lee for this presentation. Alcohol abuse frequently co-occur with post-traumatic stress disorder. In fact, studies have shown that 40 to 50% of individuals with PTSD develop alcohol use disorder at some point of their lives. This co-occurrence is not just common, it's also associated with negative consequences compared to having PTSD alone. For example, individuals with both conditions often show lower treatment adherence and more severe PTSD symptoms. Understanding the mechanism behind this co-occurrence, such as why individuals with PTSD turn to alcohol, is crucial for preventing and addressing these consequences. Emotional dysregulation difficulties in identifying, understanding, and managing emotions plays a key role in understanding alcohol use among individuals with PTSD. People with significant PTSD symptoms show greater emotional regulation difficulties and problems such as poor impulse control and goal-directed behavior under stress are a strong predictor of alcohol abuse. While the self-medication hypothesis explains that individuals who you may use alcohol to relieve emotional distress. Most studies focus on the motives rather than the emotional processes underlying alcohol use. Therefore, it is crucial to identify potential mediator that bridges emotional dysregulation and alcohol use. When individuals struggles with regulate their emotions, they often avoid their inner experiences. In PTSD population, experiential avoidance mediates the relationship between emotional dysregulation and PTSD symptoms. People with emotional regulation difficulties tend to avoid distressing thoughts and feelings, which can worsen PTSD symptoms. Moreover, emotional dysregulation predicts greater PTSD severity among those high in experiential avoidance. Beyond PTSD, experiential avoidance plays a key uh, role in alcohol abuse. Uh, Individuals with alcohol problem report higher experiential avoidance, and reducing it has been identified as a key therapeutic target. Therefore, this study examines the mediating effect of experiential avoidance, exploring how it links the emotional dysregulation to uh, alcohol abuse. So our research is conceptually grounded in the emotion schema model proposed by Leahy 2002. This model explains how beliefs about emotions affects uh, emotional and behavior responses through the four steps. First, individuals may pay attention to their emotional experiences. Uh, Second, they interpret these emotions as problematic. For example, feeling guilt, failing to accept emotions, or viewing them as incomprehensive. These steps conceptually emotional dysregulation. Individuals struggles with to identify, understand, or manage their emotions. Step 3, individuals may engage in experiential avoidance to escape these uncomfortable emotional experiences. Step 4, the avoidance can lead to maladaptive behaviors, such as alcohol use. This framework provides the theoretical basis for our model, which focus on emotional dysregulation and experiential avoidance in understanding alcohol abuse among people with PTSD. There are some studies have examined the relationship between emotional dysregulation, experiential avoidance, and alcohol abuse. However, existing research has several important limitations. First, many previous studies have used general population samples, relatively low trauma severity, which raises concern about flow effects and limits their clinical applicability. Second, although emotional dysregulation has been constantly linked to alcohol abuse, theoretical mechanisms explaining why individuals with emotional dysregulation turn to alcohol remain insufficiently addressed. Finally, um, prior studies often fail to control the key demographic factors such as income and gender that may influence both trauma symptoms and alcohol abuse. This makes it difficult to determine whether observed effects are robust or confounded by background variables. Based on this research gap, the purpose of this study was fourfold. First, we aim to examine the mediating role of experiential avoidance in the relationship between emotional dysregulation and alcohol abuse. Second, we focus specifically on adults with clinically significant trauma symptoms, which helps address the limitation of prior studies that mostly relied on general population samples with lower trauma severity. Third, we apply the emotion schema model as our theoretical framework to conceptually ground our hypothesis. Finally, we control for gender and income, uh, two important demographic factors that previous research often overlooked. Based on this purpose, we propose the following hypothesis. Let's move on to the methods part. We recruited um, 172 participants through mBrain, a South Korea online survey platform. Participants met following criteria. They were South Korean, age of 18 to 59. They had experienced at least one potentially life-threatening uh, traumatic events in their lifetime. Their PC-PTSD score exceeded clinical cutoff, indicating uh, clinically significant post-traumatic symptoms. They reported drinking at least once a month. And finally, they all had some source of income, which allows us to control for gender and income in our analysis. First, traumatic experience was assessed with the uh, life events checklist, which includes 19 trauma types with multiple response options. These measures was used to examine participants' lifetime exposure to potentially traumatic events. Second, PTSD symptoms were measured using the primary care PTSD screen for DSM-5, five-item dichotomous scale with the cutoff score of 3 or higher. This scale was used to screening tool to identify participants with clinically significant post-traumatic symptoms, and it has shown strong psychometric properties. Experiential avoidance was measured using the brief Korean version of multidimensional experiential avoidance questionnaire. It consists of 24 items rated on 6-point Richter scale. Um, And alcohol abuse also assessed using the alcohol use identification test, which includes 10 items rated on the 4-point Likert scale. It measures the alcohol consumption, problematic drinking behavior, and alcohol-related psychosocial problem, which exerts the high reliability. For the analysis, we use SPSS 22 version uh, 29 version to descript and correlation analysis, and Amos 22 version to conduct the structural equation modeling. To evaluate the model fit, we follow the criteria suggested by Klein, including normed chi-square is lower than 3 and RMSEA is lower than zero point zero 0.08, CFI and TLI over the zero point 0.90 and SRMR below than zero point zero 0.08. Finally, to test the indirect effect, we used the bootstrapping with 5,000 samples following the procedure by Fischer and Hayes. This figure shows the two structure model we tested. On the left, we have the full mediation model where emotional dysregulation influenced the alcohol use only indirectly through the experiential avoidance. On the right, we have the partial mediation model, which includes the both indirect path through the EA and direct path from DRS to AUD. In both models, we control for age and income. We compare these two models using the model fit indices introduced earlier, including norm chi-square, RMSEA, CFI, TLI, SMR, SRMR, to determine which model better fits the data and whether experiential avoidance fully explain the relationship between uh, emotional dysregulation and alcohol use, or whether direct effects remains. Before testing our structured models, we conducted descriptive and correlation analysis as shown in the table on the right. The distribution of variables are generally normal distribution. On the right, the correlation metric shows the significant positive correlation among emotional dysregulation, experiential avoidance, and alcohol abuse, which are consistent with our hypothesis and supports the proposed mediation model. These results suggest that basic assumptions of a structure equation model were met, allowing us to proceed with the model testing. This table shows the demographic characteristic of participants. The sample included approximately equal numbers of men and women. Um, in terms of the monthly income, the largest portion earn between 2 and 3 million won per month, followed by 1 to 2 million won and 3 to 4 million won. Most participants were um, college graduate and over half uh, were married. So these variables, particularly age and income, were controlled in the structure models, as mentioned earlier. These tables summarize the types of traumatic experience and levels of alcohol use among participants. As shown in the lab, the most common traumatic experience were traffic accidents, physical assaults, and natural disaster. Notably, 14% of participants reported experiencing sexual violence and 30.2 uh, 30.2% uh, reported unwanted sexual experiences, indicating that considerable portion of the sample experienced interpersonal trauma. On the right, uh, regarding the alcohol use, 44.8% fell into low risk uh, drinking range, while uh, 24.4% were in the hazardous drinking range, and 17.4% met the criteria for alcohol dependence. This distribution highlight that the significant portion of sample experienced both uh, substantial trauma exposure and risky drinking behaviors. We compared the full mediation model and partial mediation model using the model fit indices introduced earlier. As shown here, both models demonstrated good fit to the data, with norms high scale around 2, CFI TLI above 0.90, and RMCA SRMR below zero point zero 0.08, which all meet commonly accepted threshold. The difference between the two models was minimal, with the partial mediation model showing only slightly different fit indices. Given the principle of parsimony, we selected the full mediation model as the final model since it provides the adequate fits without including the direct path from emotional dysregulation to alcohol use. Next, we examine the parameter estimates for the full mediation model. First, there was strong direct effect from emotional dysregulation to experiential avoidance, indicating that individuals with more difficulty regulating their emotions are more likely to engage in experiential avoidance. Second, there was significant indirect effect of difficulties in emotion regulations on alcohol abuse through the experiential avoidance, showing that emotional dysregulation affects the alcohol abuse indirectly via experiential avoidance. This supports our full mediation hypothesis. Finally, sex showed a significant direct effect, indicating that being male was associated with higher levels of alcohol abuse, even after controlling for uh, emotional variables. To summarize our finding, first, after controlling for income and gender, emotional dysregulation significantly predict the alcohol abuse, supporting hypothesis one. Uh, Second, higher experiential avoidance was associated with greater alcohol abuse among individuals with PTSD symptoms, which supports the hypothesis two. Finally, experiential avoidance significantly mediate the relationship between emotional dysregulation and alcohol abuse, supporting hypothesis 3. Based on this model, there are several important clinical implications. First, it's important to assess the client's emotional beliefs to better understand their emotional regulation patterns. For example, emotion schema model focus on the identifying, restructuring um, ex- emotional schemas, which can particularly useful for individuals who have difficulties managing emotions. Second, trauma-informed care should be integrated into uh, alcohol use intervention. In our sample, over 55% of participants were in a hazardous drinking range, and TIC emphasized trauma screening, creating safe environments, and addressing trauma and substance use together rather than separately. Finally, interventions should target experiential avoidance. Approaches such as acceptance, commitment therapy, dialectical behavior therapy have shown promise in reducing experiential avoidance, which aligns with our medication findings. Finally, I'd like to discuss the limitation and future direction of this study. First, this study used the cross-sectional design, which limits the causal interpretation of mediation model. Future research could employ um, longitudinal design to examine the temporal relationship among emotional dysregulation, experiential avoidance, and alcohol abuse. Second, because the data were collected through the self-report online survey, we could not confirm whether these participants clinically diagnosed with PTSD or alcohol samples and use future studies should replicate these findings with clinically diagnosed samples and use multi-method assessment. Finally, these studies were conducted in South Korea, where emotional suppression is culturally normative. Future research should explore cultural differences, such as between collectivist and individualistic, consistent in emotion regulation and avoidance patterns. Yeah, here is our references to make this presentation. Thank you. If you have any question, please feel free to contact with this email. And bye.